And so on behalf of MD Anderson, I presented at this ASH conference this morning outcomes in IDH-mutated AML treated as any line of therapy with a hypomethylating agent, either Vidaza or decitabine, with Venetoclax. And the reason why we did this study is that now, fortunately, there's this paradox of choice for IDH-mutated AML with both hypomethylating agents and Venetoclax being effective, though not a targeted therapy per se. But now we have the advent of specific IDH inhibitors, which also have shown great efficacy and safety in this subset. We did a retrospective review of all patients at our institution treated with HMA and Venetoclax as any line of therapy. And these patients truly had excellent outcomes, as was expected. So in the overall cohort, so both frontline and relapsed and refractory, the complete response and complete response with incomplete count recovery rate was 67.7%. And remarkably, 90% of those responses were negative for measurable residual disease, or MRD, by flow cytometry. However, still about 40% of those patients maintained a detectable IDH mutation at time of best response, with a median duration of response of 18 months. And these results are even more impressive in the frontline setting, with a composite CR/CRI rate of 86.1%. And again, 90% of those responses were negative for MRD by flow cytometry. But again, about half of those patients maintained a detectable IDH mutation, at least using clinical grade next generation sequencing at time of best response. And these duration of responses were also excellent, in the overall cohort being 18 months, and in the frontline setting, just over 2 years. And that translated into excellent overall survival benefit as well, with a median overall survival, again, in both cohorts, so both frontline and relapse refractory groups, of 22 months, which is incredible. And really, as a secondary analysis, we looked at a subset of these exact same patients that as different treatment courses received an IDH inhibitor-based regimen that was received consecutively, so either directly preceding or directly following their treatment course with the hypomethylating agent and Venetoclax. Just take a look at the relative response rates for when they're switching between these strategies. And again, these data were quite encouraging. So, for example, 7 out of the 8 patients that initially were being treated on an IDH inhibitor-based regimen at time of losing response, either frankly or just based on rising MRD, when they were switched to the doublet of a hypomethylating agent and Venetoclax, in all but one case, the response was salvaged. So either a marrow response was reobtained, or if it was given because of rising MRD, the patient went from being MRD positive by flow cytometry to MRD negative by flow cytometry, which was encouraging. And likewise, when a patient initially was on the doublet of a hypomethylating agent with Venetoclax, if they were switched to an IDH inhibitor-based regimen, and this could include just IDH monotherapy or a doublet with the HMA, or even a triplet, so all 3 agents used, again, in over half of the cases, the response was salvaged. So even though the study was not designed to comment on the relative efficacy of using sort of non-targeted but effective therapy with HMA Venetoclax versus using an IDH inhibitor containing a regimen, it's quite encouraging to see that whatever strategy was used first, if you did need to switch strategies, all of these agents and the various combinations were effective. And there's ongoing early phase trials looking actually at triplet therapy. So an HMA, Venetoclax plus the IDH inhibitor. And so I'm sure there'll be lots of questions about whether the optimal strategy is to sequence these or use them all in combination. And and that data is forthcoming. But just philosophically, I think with a disease like acute myeloid leukemia, that can be quite lethal unless controlled. If these combination therapies are relatively safe, I think it makes sense to favor using all of your effective agents together. But again, those data are maturing.